Hello all, I'm Dr. Hema Vaithianathan, Fertility Consultant at Oasis Chennai. So in this session, let's understand more about the advanced IVF options when you're undergoing your IVF treatment. Because IVF can be done as a basic with the simplified steps of IVF. And there are so many additional treatments that can be added on to your IVF treatment depending on the individualized or the personalized causes to enhance the success rates and to enhance the outcome in your IVF cycle. So, what are these additional or the add-on IVF treatments and when they are necessary? And what are the type of patients for which these additional options can be helpful? So, let's understand more about this advanced IVF options in this presentation. So, first of all, so IVF is one of the basic form of steps that can start with because the couple need to understand the difference between IVF and ICSI treatment because most of the time the terminology that we use when you start your IVF treatment is IVF, but actually many of the couple, when especially when there is a sperm abnormality, you will need a treatment known as an ICSI, which is ICSI, intracytoplasmic sperm injection. So understand the basic difference between IVF and ICSI is important because when your IVF is done for semen abnormalities, to counteract the sperm abnormalities, ICSI treatment will be necessary. So ICSI is one of the specialized treatment in your IVF cycle for sperm factor abnormalities. So ICSI can overcome sperm abnormalities like low sperm count or problems with the motility of the sperms, or when there is problems with the shape of the sperms, ICSI can be helpful. And next is about the other additional treatment. One is about PGT. So PGT is pre-implantation genetic testing of the embryos. So it can be added to some of the cycles, especially if the couple who is undergoing IVF has prior repeated miscarriages or had repeated IVF failures. In that case, genetic testing of the embryos is helpful. So this is one additional treatment which is extremely useful in couples, especially who is experiencing repeated pregnancy loss, because we can check the embryo's health and especially the genetic component of the embryos can be tested, and then the cycle can be proceeded as a PGT cycle. So far we have understood about the ICSI as a special additional option, and we have understood about pre-implantation testing of the embryos, which is known as a PGT embryo, the genetic screening for a selection of embryos. And next comes the other additional options which can be added during your IVF cycle is sperm selection methods. So sperm selection methods are necessary when there is male factor infertility, or especially when the parameters in your sperm count is abnormal, like one or more parameters like the problems sperm count, problems with sperm motility, and problems with the sperm shape. So these are the sperm abnormalities for which some of the sperm selection methods can be helpful and which can increase the success rate of an IVF cycle. So also when there is an additional testing option for male fertility known as the DNA fragmentation index. So when the percentage of the DNA fragmented sperm in a sample if it is high, then some of the sperm selection methods can be employed to pick up the better sperms to be utilized for your IVF cycle. So the most commonly used sperm selection option nowadays is the microfluidic type of a sperm selection method, and this method can enhance the way that we select the sperms to pick up the healthy sperms, the sperms with better DNA integrity can be picked for use in your microfluidics and your IVF cycle to enhance the formation of a better quality embryos, and that way it can increase the success of the cycle. So this is one of the sperm selection method that we are understanding about today. And sperm selection method is for the selection of the sperms, and sometimes during your embryo transfer also, some of the additional options can be done for the embryos as well as during the transfer to enhance the success rates. So one such option is known as an assisted hatching technique. because for some of the times, for some women, there may be some oocyte abnormalities, which is known as the abnormalities in the shape of egg, or sometimes egg can have a thicker shell, and thereby the resulting embryo also can have a very thick outer shell. So that sometimes can theoretically can prevent implantation. And also, if the woman has had her cryopreserved her oocytes and she is coming back to utilize her oocyte, and such cryopreserved oocytes, when they undergo, when an embryo is formed as a result of a frozen oocyte, um, some of the techniques like assisted hatching can help in improving the implantation potential of an embryo. So assisted hatching involves creating a small opening in the embryo to assist the embryo for a better implantation. So assisted hatching is something that you have to understand as one of an additional option in your IVF cycle. So next, apart from assisted hatching, there are other add-on options known as usage of embryo glue. So usage of embryo glue is one of an option. So even some of the recent research studies have stressed, highlighted that use of embryo glue can increase success rate or the outcome of the IVF cycle in certain or some in certain selected group of patients. So embryo glue is as such what it involves is some usage of some enriched media, so that it helps in the nourishment of the embryo, so that it can help the embryo in better implantation. So embryo glue is one additional add-on option that can be used in your IVF cycle. So far we have understood about the sperm selection techniques for the sperms, and we have understood about the fertilization process, the intracytoplasmic sperm injection process, and we have understood about the testing of the embryos known as pre-implantation genetic testing of the embryos, and also we have understood about assisted hatching. So these are all some of the additional options that can help. So apart from these additional options as the technique, there are other medical options are available. So some of the medications that can help in certain selected patients to enhance their success rate. So we have to actually thoroughly understand the couple when they have issues like prior failed implantation or prior failed pregnancy. So in that case, we have to run a certain specific test in order to understand what additional options can help you. So if properly diagnosed and if properly utilized, additional options can be of useful. There are many add-on options available in your IVF cycle that can enhance the success rate if it is better utilized in your cycle. So thank you for your patient listening. So you have understood about additional or advanced options in your IVF cycle today. And thank you all for your patient listening.